Residents of Wajir County have been left between a rock and a hard place, with health services at the Wajir County Referral Hospital paralyzed due to lack of water and electricity. According to healthcare workers at the hospital, the situation has seen a number of newborn babies die. And as Raquel Muigai reports, the hospital's management indicates that the blackouts experienced are not the norm, as it is a problem across Wajir County.
Tuesday night, 4th January 2021, here at the Wajir County Referral Hospital. In one corner of the hospital ward is a nurse struggling to administer medication through a patient's arm. A mobile phone flashlight beam breaking the blanket darkness, bringing in some semblance of light for the nurse to work with. Outside the hospital, an ambulance has brought in a woman with birth-related complications. Sophia Rashid lost her child while giving birth in Burder settlement, some 90 kilometers away from Wajir town.
She gave birth last night. We got to hospital, but she has been bleeding the whole night. So we brought her to the hospital, but the baby has died.
With the current blackout a testament to the level of medical attention they will get, the family opts to live in search of a private facility. In this hospital, where electricity blackouts are commonplace, it is the shuffling of feet, the mobile phone's flashlight beams, and perhaps patients' cries and relatives ranting that will alert you what is going on around you in the dead of night.
There is lack of water in the hospital. There is no electricity. The entire hospital is in shutdown.
According to the hospital's chief executive officer, Dr. Bashir Mohamed, the electricity issue in the hospital is a general county problem. He states, and I quote, "I am aware there have been outages like the rest of Wajir. It is a KPLC problem. It is not a norm. There has been power outages before. But sometimes the hospital has been using a backup generator, but it also developed a problem because of the outages. I can, however, confirm that there have been no lives lost."
Babies dying in the NBU, they died because there was no electricity. That is not our fault. We cannot do anything about it. Yeah? If the generator has been procured, should it be in place already?
The last 1 week, the Wajir Regional Laboratory has been closed. There are no reagents to do the vital tests required. Public healthcare services here in this area are at a standstill.
Hakuna mtu anafanya operation, hakuna mtu kusalishwa, hakuna sitima, hakuna bobote. Na serikali iko wapi? Hakuna bali ya kusafisha na luka kama kitu kingine.
But healthcare workers have been so consistent in terms of working in conditions that are very deplorable. Yeah? And we will continue serving services in such conditions.
They state that efforts to have their issues addressed by one of them saw their colleague physically assaulted by officers alleged to be attached to the county governor.
We felt that the process that would lead to the apprehension of these officers was going very, very slowly. So as healthcare workers, the only language we understand is industrial action.
Our texts and calls to the county's health department and leadership have gone unanswered. While the day gives reassurance to the Wajir County residents that at least there could be a level of medical assistance accorded to them at the hospital, nightfall brings along a different scenario, one that even the healthcare workers here are wary of. Raquel Muigai, Citizen TV.